There are many contributing factors which have affected Patrick's respiratory system. Firstly, he has a history of smoking for approximately 40 years of his lifetime. This would be a likely cause of developing chronic obstructive pulmonary disease, or COPD, which is one of the main contributors to Patrick's current symptoms, including fatigue, persistent coughing, dyspnea, as well as the fluid retention or edema in his lower legs. This is also demonstrated in the low hemoglobin count shown in his blood test results. A low hemoglobin count is typically associated with poor lung and heart function and is decreasing the oxygenation of the body's organs and muscles. The main symptom of low hemoglobin is fatigue. Finally, Patrick's BMI is calculated to be 29.3, indicating he is overweight. It is suggested that being overweight, and particularly having a high waist circumference, can impede on diaphragm movement, reduce lung expansion, and overall reduce lung capacity. Patrick's history of a myocardial infarction and left-sided heart failure may also contribute to shortness of breath and edema in the legs. The combination of COPD, being overweight, as well as Patrick's heart health can be considered a domino effect, in which each factor worsens the other. Being overweight makes it harder to breathe and can also cause decreased physical activity. This will then cause muscles, including ones involved in respiration, to weaken, which in turn making breathing even more difficult. Patrick's medical history and current health status are also contributing to his heart rate. He is experiencing tachycardia, in which his heart rate is greater than 100 beats per minute. Factors include his high blood pressure. Having a rapid pulse is also a symptom of left-sided heart failure. This is because left-sided heart failure decreases ability to pump oxygenated blood to the body, and so the heart must work harder to complete this task. An unhealthy or weakened heart pumps faster due to its inability to deliver greater volumes of blood with each beat, and so it needs to pump faster in order to meet the body's oxygen and nutrient demands. Secondly, the lack of oxygen in the blood due to lung function means that heart may be attempting to compensate to deliver the appropriate amount of oxygen to muscles and organs. Another contributing factor is Patrick's weight, which is restricting blood flow through arteries and veins. Being overweight also increases workload of the heart, more so to do with body composition rather than total body weight. Fat does not contribute to the mechanical function of the body and so increases the workload of muscles. Thus, the more your muscles are functioning, the more oxygen required, the faster the heart will beat to meet demand. Patrick's diagnosis of COPD and left-sided heart failure play a role in affecting the body and are linked in many ways. Firstly, it is likely that COPD developed due to his history of smoking. Smoking progressively damages the walls of the upper and lower respiratory tract and contributes to the elasticity of the lungs, inflammation of airways, and mucus buildup. Smoking is also a contributing factor to damaging the lining of the arteries and the buildup of fatty substances. Not only does smoking narrow arteries, but also his current weight suggests that he has lifestyle choices that are also contributing. Narrowing of the arteries is likely to be an underlying cause of his history of myocardial infarction and contributes to the potential cause and worsening of Patrick's left-sided heart failure. Left-sided heart failure is progressive weakening of the left ventricle of the heart and can have a number of causes, including Patrick's history of myocardial infarction. The left ventricle of the heart is responsible for pumping oxygenated blood towards the body. As the left ventricle pumps harder to compensate, it grows weaker and thinner, and as a result, blood flows backwards into organs, causing fluid buildup in the lungs and/or swelling in other parts of the body. It is not likely that one condition has led to the other, however both have overlapping causes, similar symptoms, and it is possible that they are to worsen each condition's progression. This is shown in the Venn diagram. Patrick is now at risk of developing right-sided heart failure. When the left ventricle fails, increased fluid pressure is transferred back through the lungs and ultimately damaging the right side of the heart. When pulmonary edema occurs from the left-sided heart failure, blood is not able to be pumped from the right ventricle into the lungs to be oxygenated. This impairs gas exchange process, leading to hypoxemia and hypercapnia, causing further implications. When this ability to pump is lost in the right side, blood will back up in the body's veins. This will cause enlarged veins and organs and peripheral edema. Overall, right-sided heart failure will present with increased jugular venous pressure, enlarged liver and spleen, abdominal and peripheral edema, and reduced output to pulmonary circulation. Patrick's blood test results also from what is considered a healthy range. Firstly, his sodium levels are above the normal range, which may be a result from dietary choices. High sodium causes the body to retain fluids and would worsen the fluid buildup that is occurring with heart failure. His potassium levels are slightly higher than the normal range, which may also have effects on the body. In terms of neurological function, sodium and potassium are essential for neurotransmitter action. This is demonstrated in the sodium-potassium pump, in which sodium and potassium ions are moved across the cell membrane as a mode of active transport and increasing cell ATP concentration. If there is too much sodium, fluid will leave the cell, causing it to shrink and impede damage. Note that Patrick's calcium levels are within normal range, but also at risk of becoming too low. Next, Patrick's results show low hemoglobin count, which is likely related to his conditions of COPD and left-sided heart failure. In particular, left-sided heart failure is affecting the ability for oxygenated blood to be transferred to the body, and especially the brain, which accounts for up to 20% of the body's oxygen supply. It is suggested that low oxygen supply is related to poorer cognitive function. Thirdly, Patrick's glucose levels are considered above normal range. This may be affected by his diet, especially considering he is overweight. Glucose is necessary for the function of energy production in cells in the creation of ATP. Glucose, along with other oxygen, plays a necessary part in the citric acid cycle, which creates an abundance of energy for cells. However, if it is in excess for a longer period of time, it can result in nerve damage. Next, Patrick's LDL levels are above normal range. LDL is essential for neurological function as a component of myelin sheaths protecting neurons. His HDL levels are lower than a healthy range, and he also has high levels of triglycerides. These three components are most likely affected by a diet that contains high saturated fats and low unsaturated fats. Another blood test result that can be completed is a blood gas test, which measures levels of oxygen and carbon dioxide in the blood. It would be expected that there would be low levels of oxygen and high levels of carbon dioxide in the blood. This is due to the lack of hemoglobin as shown in the test results, COPD, and left-sided heart failure diagnosis as discussed earlier.